Hemophilia is a rare bleeding disorder. This means the blood doesn't clot normally. People with hemophilia bleed for a longer time than others. It is important to understand hemophilia because it can cause serious health problems. These include internal bleeding and joint damage. Early diagnosis and treatment can help prevent these complications. This allows individuals with hemophilia to live full and active lives. Hemophilia is a genetic disorder. This means it is passed down from parents to their children through genes. Genes carry instructions for making proteins. In hemophilia, certain genes have errors. These errors prevent the body from making enough clotting factors. Clotting factors are proteins that help stop bleeding. Hemophilia is more common in males than females. This is because the gene for the most common type of hemophilia is located on the X chromosome. Symptoms of hemophilia vary depending on the severity of the disorder. This genetic condition affects the blood's ability to clot properly, leading to a range of symptoms that can be mild, moderate, or severe. Some people have mild symptoms which might not be immediately noticeable. They may only experience excessive bleeding after surgery or a serious injury. Others experience more severe bleeding episodes, which can occur spontaneously without any apparent cause. These episodes can be life-threatening if not treated promptly. Common symptoms include excessive bleeding from cuts or injuries, easy bruising, joint pain, and swelling, which can lead to chronic joint damage if left untreated. Additionally, blood in the urine or stool is a significant indicator of internal bleeding, which requires immediate medical attention. If you or someone you know experiences any of these symptoms, it is important to see a doctor right away. Early intervention can make a significant difference in managing the condition effectively. Early diagnosis and treatment are crucial for managing hemophilia and preventing complications. With proper medical care, individuals with hemophilia can lead healthy and active lives. Managing hemophilia involves several treatment options, each tailored to the specific needs of the individual. The primary treatment is called replacement therapy, which is essential for managing the condition effectively. This involves injecting the missing clotting factor into the bloodstream, helping the blood to clot properly. There are two main types of replacement therapy. First, there's prophylactic treatment, which is a preventive approach. This involves regular injections of clotting factor to prevent bleeding episodes, reducing the risk of spontaneous bleeds. Then, there's on-demand treatment, which involves receiving clotting factor only when bleeding occurs, addressing the issue immediately. In addition to replacement therapy, other treatments for hemophilia include medications to promote clotting, which can be crucial during bleeding episodes. Physical therapy is also important to maintain joint health, as joint bleeds can lead to long-term damage if not managed properly. And finally, gene therapy, which is currently under investigation, holds promise for a potential cure by addressing the root cause of hemophilia at the genetic level. Hemophilia has some fascinating historical connections that span centuries and continents. One particularly intriguing fact is its link to royal families, which has been well documented over the years. Queen Victoria, the Queen of England from 1837 to 1901, was a carrier of hemophilia. Her reign was marked by significant political and social changes, but her genetic legacy also had a profound impact. She passed the gene on to some of her children, and it spread to other royal families in Europe, including those in Spain, Germany, and Russia. This genetic transmission had far-reaching consequences. This led to hemophilia being known as the royal disease, a term that highlighted its prevalence among European nobility. The condition affected the lives and reigns of many royal figures. Another interesting anecdote involves the discovery of clotting factors, which was a monumental step in medical science. Back in the 1940s, scientists discovered that plasma, the liquid portion of blood, contained factors that could clot blood. This was a groundbreaking discovery at the time. This breakthrough led to the development of the first clotting factor concentrates, which revolutionized the treatment of hemophilia. These concentrates allowed for more effective management of the condition, significantly improving the quality of life for those affected. Today, ongoing research continues to advance our understanding and treatment of hemophilia, offering hope for even better therapies in the future. Hemophilia is a rare bleeding disorder that prevents blood from clotting normally. It's caused by genetic mutations that affect the production of clotting factors. Symptoms include excessive bleeding, easy bruising, joint pain, and blood in the urine or stool. Treatment involves replacing the missing clotting factor through injections. Understanding hemophilia is crucial for early diagnosis, effective management, and improved quality of life for individuals with this condition.